Hi Abby, good to see you too. Did you see what the guest speaker is covering today in class?
Yeah, I saw it. Patent Foramen Ovale, right? I've never heard of it before. Have you? It sounds kind of scary.
Yeah, I've never heard of it either.
Hello ladies, my name is Dr. Ovale and I will be your guest speaker for today's class. Welcome to the Patent Foramen Ovale information session. To put it in simpler terms, I will refer to Patent Foramen Ovale as PFO.
Sounds great. I'm looking forward to it.
To help you understand why there is currently a hole in your future little girl or boy's heart, let's talk about some simple anatomy of the heart. The heart consists of 4 chambers and is the organ responsible for pumping oxygenated blood to your body's tissues and organs. It is also responsible for delivering deoxygenated blood to the lungs. This function of the heart is so important because your tissues and organs require a constant supply of oxygenated blood to function properly. Oxygenated blood from the lungs then enters the heart through the pulmonary veins into the left atrium. The left atrium will contract, pushing the oxygenated blood into the left ventricle, passing through the mitral valve. The left ventricle will then contract, pushing oxygenated blood out of the heart through the aorta and be distributed to all parts of your body. The right side of the heart has a slightly different function. Deoxygenated blood from your body's organs and tissues will enter into the right atrium of the heart via the inferior and superior vena cava. The right atrium will contract, forcing blood to enter the right ventricle via the tricuspid valve of the heart. Now, the right ventricle will contract, which forces the blood to exit the heart via the pulmonary arteries. The deoxygenated blood will then travel back to the lungs to get reoxygenated.
Thanks, Dr. Ovale. Now that we understand the anatomy of the heart, how can we use our newly acquired knowledge to learn about PFO?
Now that you understand the anatomy of the heart, I'm going to show you a diagram that will help explain what PFO is. Foramen ovale, or the small hole in a developing fetus's heart, is actually completely normal and necessary. During pregnancy, your babies are still so small that some of their organs are not fully developed. When your babies are in utero, they do not breathe as you and I would. Their lungs are filled with amniotic fluid, so they are unable to breathe and use their lungs properly. As a result of this, there is a hole in the baby's heart to make it easier for them to distribute blood to all parts of their growing bodies. You probably noticed that the blood within certain chambers of the heart in this diagram are purple. This represents the mixing of your oxygenated and deoxygenated blood supply as a result of the hole in your baby's heart. PFO occurs when a small hole in your heart doesn't close shortly after birth. No need to worry. More people than you would expect are living with PFO and live very normal lives. Do you ladies have any questions so far?
Yes, I have a question. Where does this hole actually occur in the heart?
Great question, Sarah. The hole occurs in the interatrial septum of the heart, or the wall that separates the left and right atria of the heart. Does anyone else have another question?
I think I'm starting to understand PFO, but I'm still a little bit confused.
No need to worry, Abby. I have a simple analogy that will make this concept easier for you to understand. Think of the heart as a box of Nerds candy. For those of you who are not familiar with Nerds candy, it is a small box with 2 flavors of candy separated by a piece of cardboard. The piece of cardboard that separates the 2 flavors of candy can act as the interatrial septum, and the 2 compartments can represent the left and right atria containing different types of blood. If the manufacturing company did not notice a hole in the piece of cardboard used to separate the 2 types of candy, there would be a mix of flavors when you open the box. This mixing of flavors is analogous to the mixing of oxygenated and deoxygenated blood in the heart in patients who have PFO.
Thanks, Dr. Ovale. That clears everything up.
Okay, so now that you ladies understand what PFO is, I am going to give you some additional information about management and treatment of PFO.
Sounds good.
So something you both are probably wondering is what happens if this hole does not close. Most people with PFO do not actually need to be treated for this condition. However, sometimes your doctor will recommend the closure of the hole if your child is displaying low blood oxygen levels, or if your doctor has a reason to be concerned about the possibility of stroke.
Oh, how does PFO increase your risk of having a stroke?
Well, normally your body will produce small blood clots. However, these little clots will usually be filtered by the lungs when the deoxygenated blood arrives from the body. With PFO, the blood clot is able to skip this filtration step by crossing over from the right atrium, which is destined for the lungs, back into the left atrium, which will put this clot back into your body's circulation. If the clot is allowed to re-enter into bodily circulation, there is a risk of it blocking an artery, preventing blood flow to the brain, and causing a stroke.
Wow, that sounds serious. Is there any way for doctors to treat this?
Yes, there are two main options for management of this disease. One possible treatment option would be a specialist prescribing you medication to prevent blood clots from forming in the body, which normally include drugs such as aspirin and warfarin. However, if strokes continue to persist even after taking medication as instructed, then surgery to close the hole is often required to manage this disease. Anyone living with PFO should be having regular appointments with the doctor for continuous monitoring and tracking. Well, that pretty much sums up PFO. Do you ladies have any other questions?
Nope, I think we both have a pretty good understanding of PFO. Thanks, Dr. Ovale.